Welcome to Gather for Wellness Radio. I'm your host, Becky Litwicki, and it's Wellness Wednesday, which means we get to connect with another kindred spirit to expand our health and happiness and move one step closer to discovering our own magic formula for optimal wellness. It's my honor to introduce Dr. Greg Schulte for episode number 20. Dr. Schulte is who first introduced me to a more holistic world of wellness when I started working for him at his chiropractic office in St. Charles, Illinois. In addition to chiropractic care, Dr. Schulte specializes in nutrition response testing, orthotics, kinesiotaping, active release therapy, and other lifestyle support. I have learned so many things from him and have been inspired to explore even more. One of my favorite things I've learned from Dr. Schulte is the belief that the body is designed to be well and that health comes from within. Throughout this episode, you'll learn how chiropractic care plays an important role in all of that. Dr. Schulte, welcome to the show.
Thanks, Becky. Appreciate you having me on.
Absolutely. Guys, I'm so excited to have Dr. Schulte here today. He is the one who kind of originated this whole new path for me to take and inspired me to start eating more real food and get chiropractic care and look at the supplements I was taking and really just embrace a more holistic lifestyle. So he's taught me a whole ton and inspired me to learn a lot more on my own. So I'm really excited for him to be here today to share his wisdom with you guys. So let's start with talking about some chiropractic care and what actually happens when you get adjusted, Dr. Schulte.
Well, when people get adjusted, there's several things that happen at once. I mean, obviously there can be, depending on the type of adjustment and the technique used, there could be actually physical movement of the joint. And some techniques do not even have that. They've got more of a what we call a tonal technique, where you might use some type of a light force or an instrument. So I'll kind of start with more of the manual adjustment. With the manual adjustment, we are physically inducing movement into a joint to, number one, increase the function of the nervous system. As soon as you get a joint moving, all those proprioceptors in the joints, which are the little nerve endings that sense where they're positioned at, they fire off up to the brain. If there's stress or inflammation in the joint, that can be released by getting the joint moving. As with, similar to like an exercise, you move a joint and you actually get stimulus into the joint. So with an adjustment, though, we're putting specific input into the nervous system to allow for a better state of health and function by doing that chiropractic adjustment. And it's an amazing process, and there's tons of research that shows what happens when you actually have an adjustment that happens to your body. Then the other side of an adjustment is more what we call an instrument-based adjustment or a low-force adjustment, which I do a technique related to that too. And that is actually using a light impact to the joint for people that do not either want the manual adjustment or they may do it better with a non-manual adjustment. And same thing is that you're actually firing off nerve endings and sending input up to the brain and central nervous system, so then you can get feedback into that area. And it's just a really great, what we call feedback loop. So a message gets sent up to the brain, and the brain sends a message back down, and it increases the function of whatever nerve or area or segment that you're working on in that spine. So if I'm working on an area that might go to the stomach and upper digestive area, someone may come in with those types of complaints, but based on what I find through my palpation findings, I can use different types of adjustments to help increase function of the nervous system, therefore increasing overall health of their body.
So do you, a lot of times I get manually adjusted, and a lot of times there's a lot of popping and stuff going on. So if somebody pops their back all the time, is that essentially the same thing as what you do then?
Well, typically when someone's trying to do their own quote-unquote adjustment, what they're doing is they're getting segments of the spine that are already probably moving very freely, and they're just putting more movement in there. And those are not the ones that need the attention. The ones that need the attention are the ones that are fixated, or what we would use the word subluxated. They're basically locked up. They're not moving. There's stress on the joint. There's stress on the nerve. There's no motion happening in there. And the areas above and below that are having excessive movement where they're getting overstressed. So what we do is we want to focus on those areas of the spine where we're having limited motion or movement, or feeling tension, inflammation, and then we want to increase or induce movement into those areas. So when people quote-unquote do their own adjustment, I usually tell them it's not the best thing to do, because they're putting, number one, an active stress on the joint. So they're actually pulling tendons and muscles against the joint. So they have potential for what we call micro tears. So they can actually get a small amount of tearing into the tissue. And what happens when tissue tears? It heals with scar tissue. And down the road, over time, if they do it often enough over a number of years, they could probably end up in limited motion of that joint, therefore getting concerned with, wow, why can't I move my neck anymore? And they keep doing the process over and over again. Also, it can become very addicting to people because they always are feeling like they have to have that movement in there because it's never actually getting correction of the underlying cause.
So a subluxation is when there's like interference in the nervous system. I know you've taught me that, but how can somebody identify if they have subluxations, or what if somebody, quote unquote, never has subluxations?
Well, people always ask me, where do subluxations come from? And it's an awesome question. And usually we have this question when I have a new patient in the office because they're wondering, what is the subluxation thing? I've never heard of it. Where does it come from? How do I get it? How do I prevent it? And number one, when we look at it, the definition of subluxation in our office is looking at stress on the nervous system by inactivity or immobility of a joint of the spine. So you're seeing that there's multiple things happening at the same time. The joint may not be moving in the spine or somewhere else in the body. It could be a wrist or an ankle also. And when that's not happening, there's having interference to the nerve impulse that is traveling from or to that joint, therefore interfering with the body's ability to communicate and heal itself properly. I mean, truly, all healing comes from within. We do not get healthy by doing things from the outside. Health comes from the inside. So what we have to do is we have to figure out how we can best support our nervous system through clearing these subluxations out and allowing your body to work at its best. So when people are saying, well, do I have them or how do I get them, the biggest thing is to look at the main causes. And some of the causes, obviously, the people know that they're physical. So physical causes, it could be stress. It's like, I stepped off a ladder and there was one step left and I didn't know it and I tumbled down. Well, there's a physical stress there. Yeah. You could be in a car accident or a fall. Things that people think about a lot, those physical type traumas. Also, they could be working out excessively or heavy weightlifting. Those can cause stresses. Now, exercise is a good stress, but also there can be a negative side of that if too much is done or if your body's taken beyond its ability to be able to exercise. So there are physical things there. We've got then the physiological, or what we call the biochemical things. So how is your diet? What are you putting in your body that you shouldn't be, or what are you not putting in your body that you should be? So the example would be, yes, I love, if someone comes in and may say, I want to eat 3 Twinkies a day. I'm like, well, you may want to eat Twinkies every day, but should you eat Twinkies, or should you maybe think about a spinach salad every day? So looking at how are you feeding that body? The nervous system needs the same nutrition that your stomach, your heart, your lungs, and your liver need. They all feed off the same nutrition. So it's like the old adage says, garbage in, garbage out. If you don't eat healthy and properly fuel yourself, you're going to create stress on that system, and that system is your nervous system. And then there's the third one, which is the mental, emotional types of stresses. So the example is, driving down the highway and all of a sudden all you see is red brake lights popping up in front of you. What happens? How do we respond to that? You think about that, your hormones start to fire off. Your heart rate goes up. You feel hot. You get sweaty. You start gripping the steering wheel harder. Well, those are stresses that affect your nervous system. Your body's job is to adapt to those stresses. Well, guess what? If you do it often enough, it starts to get kind of wore down and literally stressed out. And that's where subluxations can occur, because those stresses can cause misalignments and pulling and tugging on the muscles, pull the spine out of place, and next thing you know, you've got a pattern of misalignment that you weren't having before. And over time, that can become an issue.
So with some of those subluxations, it's not really something that the person themselves can always identify, right?
Now, the only way that I know to identify them is by seeing a chiropractor, because that's what we're trained to do. We're trained to evaluate the spine and nervous system function to see how it is. And some people come in and they think they're feeling great, but we may find a few things that are underlying through a history and through an evaluation. And other people come in and they feel absolutely terrible, but their actually evaluation is not as bad as they thought it would be. So the best thing to do is to find a well-trained chiropractor that can look at you from a holistic standpoint and determine where these subluxations may be, what's causing them, how to correct them, and then what you can do to keep them from happening over and over again. So we also want to work on prevention, which is a huge part of what we do in our office, is helping teach people what they can do to stay healthy, strong, fit, active, and live that healthy quality of life that they want to live.
So is it possible for people to not actually have subluxations, or how long, if you had your subluxations cleared by a chiropractor, how long does that last, and how long can they expect to be without those?
Okay, that's an awesome question, and that's a question I think I get almost every day in my office. And people say, what do I need to do to prevent this from occurring again? And I'm like, all right, you need to do all these core basic things, as I kind of call it the wheel of health. If you look at like a round circle, and there are many pieces of, we'll call it wedges of pie in that circle, and I would put chiropractic as one of those. Also hydration, exercise, healthy eating, mental health, things such as meditation. All those things are part of what you should do to help maintain your health. It's not just do one thing and everything gets better. So what we look at doing is saying, okay, if you want to get well and you want to maintain proper spinal and nervous system function, what are you doing to minimize the stressors on your life? Now, if you're traveling 200 days a year and you're eating out every day and you're not exercising, you're sleeping 4 hours a night, guess what? It's going to be next to impossible to do that. Your body can't handle that stress. And what it does, it actually gives you signs, and by breaking down. So whether you choose to listen to those signs or, that's a whole other question there, because people can ignore them for many years.
Right.
But what we want to do is we want to say, okay, do you have subluxations? How do we know we have them? We want to evaluate them. In this day and age, with the amount of stress that people are under, the quality of food decreasing almost every year, and the demands on our bodies, it's next to impossible to completely stay clear of them. But what it is possible to do is get a care plan that can correct them, basically retrain your body into a great state of function, and then give you pointers and tips that you can do to minimize that from occurring moving forward. Something as simple as like, I talk to patients throughout the week about what are your ergonomics like at your desk chair. And when they kind of show me how they sit and they describe that to me, I know exactly what's happening. Their shoulders are rolled forward, their head carriages way forward, they're sitting on the edge of their chair, they're not even using their back of the chair to support them. In a couple of quick minutes, I can tell them exactly how they could sit at their desk chair to minimize that stress on the body, and that right there can reduce the subluxations on their neck and upper back and lower back regions just by doing that one simple thing. So those are the kind of tips that we want to give people to keep from increasing the number of subluxations they have in their spine, and therefore keeping proper nerve function and keeping them as healthy as long as possible.
And I think a lot of people think that they need to feel like they're in pain before they come see you. But one of my favorite things, I remember you talking about how even like riding a bike, like being in a position of riding a bike can cause subluxations, especially if you ride for extended periods. And most people would think that riding a bike is completely healthy, but it just goes to show that chiropractic care can kind of go in conjunction with things like exercises that are healthy to continue to support that.
Yes, I'll handle that in two parts here, Becky. Number one is we'll talk about if I'm not in pain, do I need a chiropractor? And then number two, we'll talk a little bit about kind of more performance and function of the body. So the biggest way to answer the if I'm not in pain, do I need a chiropractor is I ask people the question, do you know what percentage of your nervous system controls pain and sensation? And most of them give me a blank stare because we don't learn this in high school biology or anatomy class, which we probably should. I wish I would have. But only 10% of your nervous system senses and controls pain. And that's a pretty small amount. So you have to think, if 10% of my nerve is compressed or irritated or inflamed, guess what? I'll feel pain. But what does the other 90% do? And that's the big question people have, and they really don't know. And where we come in is we like to educate our patients that 10% of your nervous system, every nerve in your spine, is pain-related, and 90% of each of those nerves is function-related. So all the muscles have to run off those nerves, and every single organ has to run off the same nerve. So the nerves have multiple different tasks that they perform, and one small one is pain. Well, we all know that when we feel pain, we know there's something going on. It's a great indicator, and I like to call it the red light on the dashboard. So you're driving your car, the red light comes on and says, check engine soon. So what do? Do you put a piece of tape over it and cover it up? Do you just kind of take a piece of paper and slip it in your dashboard so you don't have to see that light for another 6,000 or 10,000 miles and hope the problem goes away? Or do you go home, call your mechanic, make an appointment, and have him take a look at it, see what's going on? So the pain is the red light on the dashboard. That's what we see a lot of people for. But also when we see those people, we get in, we start asking them questions about their health and overall well-being, and we start to get more information about the other aspects of the nervous system. Then 90% of the nervous system starts to come out and say, well, yeah, I'm a little bit stiff in the morning, or I don't have full range of motion in my shoulder, or maybe I've got some indigestion, or I'm just not feeling as well as I should, my energy level's low. Those are areas where people come to see a chiropractor and come to see me quite often because they want to live a high quality of life. And they know that pain is only a piece of that. Well, yes, we want to be pain-free. Absolutely, I agree 100%. But beyond that, there's so much more that I can do to help them be healthy. Because healthy does not just mean an absence of pain.
Yeah.
Healthy is much more beyond that. So that's really how we handle that question, whether you need a chiropractor. It's completely up to you. But to come in and get checked and see where you're at is the best way to start. That way, at least you have some data, some information, and know where you're at so you can move forward from there by making an informed decision. The other side of it is, if you talked about when you're using your example of bike riding and someone wants to sit in a position, maybe they ride bikes, say, for 4 or 5 hours a week, which is quite a long time to be in a bent-over position. I kind of go back into more of a performance-based or functional-based evaluation. As we take a look at people, and I want to find out what they do and how I can help them do that better. Examples, I take care of several high school athletes and swimmers, and my daughter's a water polo player. We'll talk about an intense sport, something that really takes its stress on the spine and all the other joints of the body. We utilize chiropractic for her not just to get well, but really more importantly to stay well and to function at her best. Because once I know that every joint is functioning well, the spine is functioning well, all the nerves are getting the proper messages of where they need to be, her body can heal and repair itself quicker than it could without that type of help. So really looking at it from a functional standpoint is people want to function well. Nowadays, the biggest thing is not how long you live, it's how good you live those years that you have. What's the quality of life that you're going to have? Do you want to live to be 90 and spend the last 20 years in a nursing home? Or do you want to live to be 80 and go all out until the very last day? I think most people are going to pick the 80, and we want to help them live that 80 quality years.
So earlier you talked a little bit about how food plays a big part in your overall health and well-being, and you also mentioned how it's not the same quality that it used to be. So what kind of supplementation do you recommend in order for maintaining health, even if you are on a healthy diet?
Supplements are a huge topic in my office. It comes down to this. I look for people to get supplements that are as close to Mother Nature's design as possible. You want whole food supplements, things that are grown in the ground, not created in a laboratory. Most supplements this day and age are synthetic, meaning that they're not whole food. They're not what I would say natural, meaning as Mother Nature meant natural. And they're creating them so they can mimic vitamin C in a laboratory and vitamin D3, and they can find all these things and create them, absolutely. But are they the same? Absolutely not. They are not. Your body doesn't absorb them the same, it doesn't utilize them the same, and you're not going to get the same outcomes. I truly believe that finding things that are made as close to whole food supplements as possible is the way to go. So when you want to get something with vitamin C, you want to find the plant that has the highest density amount of vitamin C that you can get. You want to get that plant, you want to figure out how to get that in your body without having to eat the whole plant. So by actually extracting that portion of it. I highly recommend standard process products. I like to use them. I've been using them for years. I find great results, and they are a whole food company. They have an organic farm in Wisconsin. They produce all their own products. They just have a great product line. They have many different options. Now, you can only get them through healthcare providers, and the reason for this is that they want to make sure that people are getting the right products that they need. They don't want this just grabbing things off the shelf and not knowing exactly what's going in their body and why they should get that. So I always tell people, find a healthcare provider in your area that handles standard process and get some core nutrients that you need. Get some of the basics. They have a great daily essentials pack, which is it's just a very simple, you tear the top off the pack, you put it in your hand, you swallow it, and you do it twice a day, and that's it. That's all you need to do. If you just do that, you're going to be ahead of probably about 80% of the people that are out there taking supplements. I know there's always the latest and greatest craze out there, and so-and-so's neighbor lost 80 pounds in 3 days, and their energy went from 0 to 100 in 2 weeks, and I get it. They're out there. Unfortunately, most of the people that are doing that are people that are probably fueling their body with those Twinkies I talked about earlier. Yeah. And once they finally put some real food in it, their body's like, wow, look at this, food. Oh, my goodness. So, start off by putting some food in, some salads, some raw vegetables, some steamed vegetables, some real whole food protein, good fat, and avocado is an awesome thing. Coconut oils, cooking some, extra virgin olive oil, things like that are awesome for your body. And if you're just eating out of a box or a bag, you're not getting nutrition. You're eating food-like substance, and food-like substance will not help make a healthy body.
Mm-hmm. And I remember you talking one time about how the food that we put in becomes our new cells. And if you're putting in crap food, then you're going to get crap cells. And you referred to it as kind of like that, like the photocopy, right? Like you just keep, it's like...
Yeah, if you just keep using that same copy over and over again, and you copy the next one, copy the next one, copy the next one, guess what? You're not going to be able to see it after about 20 versions.
Right. So we got to keep putting the good stuff in. But when we're not putting the good stuff in, or even if we are putting the good stuff in, where we eat a fairly healthy diet, but maybe we're stressed out in other ways, we can get sick. So how does chiropractic care come into just like helping someone when they have a general cold or flu, or something more acute like that?
Well, we've got different systems of the body, Becky, and one of the main ones there obviously is the immune system, and people have heard of it. Everyone knows about the immune system. Very few people actually know how it works unless you understand, you're a physician or you work in research or understand biochemistry. But the immune system is one of the many systems, and it works with 24/7. There's no breaks. Mm-hmm. It's constantly going in there trying to create healthy cells, get rid of the bad ones, get rid of the ones that are in there trying to invade you, infect you, viruses, bacteria, fungus, parasites, all those things there are cleaned out through the immune system. So with chiropractic care, the goal is really not necessarily to focus just on the immune system, but the goal is to create an overall healthier body by allowing the nervous system to work optimally. And your immune system is controlled by your nervous system. Obviously, it gets messages from the brain down to the body. And what we want to do is we want to allow those messages to get through to the immune tissue as ideally and optimally as possible. Once that happens, your immune system can identify the foreign invaders. It can figure out what it needs to do to help rid your body of them. And then also, you got on the back end of that, you've got new cells being put in place. So the more that we can get rid of those old cells, as you kind of talked about with the photocopy, because your body's only going to make new cells based on the old blueprint that's left behind. So if you have a great cell, you're going to get a great new cell. If you have a sick cell, you're going to get another sick cell, which is the definition of cancer. I mean, everyone has a cancer cell in their body probably at all times because it's a mutated cell is all it is. The problem occurs is when those mutated cells take over and they start at a very high growth rate. And if you can put good things in your body and keep your body working great and support your immune system, there's going to be less likelihood of those cells taking over and growing. Now, does it happen? Absolutely. But you want to minimize the chances or you want to maximize them? So you want to minimize the chances of those cells taking over your body by putting those great nutrients in there, feeding the dark green leafy vegetables, eating those lean grass-fed animal proteins, putting the right kinds of oils in your body, getting proper sleep, exercise, all the different components that are necessary to do that are all part of supporting the immune system, to minimize the chances of a cold or flu. The other aspect is that, as I tell my patients, if you start feeling sick, get in right away for another adjustment because it's going to just boost up that immune system by increasing nervous system function. Then also I have some great home recipes I'll give people to support themselves. I'll make suggestions as to what they should be drinking, how they should be eating, how much rest they should be getting. All those things that we might kind of put by the wayside because we're too busy. We've got to get to work. We've got to run Johnny here. We've got to do this or that. But we neglect taking care of ourselves. So the person that can take care of themselves, get an adjustment, eat healthy, their cold might be 3 or 4 days. The average individual, somewhere right around 14 to 17 days in our society. I much prefer the 3 to 4 days.
Yeah. And I know you've talked about, too, when you get adjusted, there's an increase in white blood cells, right?
Yes, yeah. You get your immune system, it's like a burst. White blood cell production will boost up, after you get adjusted because your immune system's out there now working at a higher level, and it's going to go out there and kind of seek out those bad invaders.
Okay, great. So chiropractic care when you're sick. What about for, most people associate chiropractic care with back pain, which we've already talked about several reasons why it should be used beyond that. But what if they have pain in an extremity, like a knee or elbow, ankle, something like that?
Kind of like when you had your shoulder a little while ago?
Yeah, kind of like my shoulder.
Absolutely, yeah. I remember that. Yeah,
me too.
Becky was doing some pretty intense workouts for a while, and she was wondering why her shoulder wasn't keeping up. So, we definitely work outside the spine. Most people think spine. Many people don't realize that chiropractors, at least where I went to school, are trained in working the extremities, such as the shoulder, the elbow, the wrist, the knee, the ankle, the foot. All those areas there are areas that we can help with by increasing function in the joint. If someone's having problems with like a heel pain or a foot pain, I'm going to evaluate and see how the movement is in their foot joints. And if they need it, we'll adjust them down there. Same thing with like a shoulder. Also, we would probably integrate some soft tissue or deep tissue technique around those areas, because not only do I want to get the joint to move, I want to ensure that the soft tissue is going to allow that joint to continue to move properly. And then obviously evaluating for any type of soft tissue injuries or inflammation that may have occurred from extreme exercise, or even if someone was just like lifting or carrying things overhead, or something was slipped that they were holding and they went to grab it and hurt themselves. Those are types of things we see all the time, but absolutely want to address all aspects of the body. So when I ask my patients questions in the history, the last one is there anything else that you want me to know about? So, and I kind of prompt them a little bit, different areas that they may want to think about, because they might not think outside the spine when they're coming to see me.
Mm-hmm. All right, so in addition to extremities, you also do some awesome work with little babies. So can you talk about why a parent would bring an infant to you for you to adjust them? It seems to someone who doesn't know what a infant adjustment looks like that it might be a little bit aggressive. Can you talk about how it's different from how you would adjust most adults and how it benefits them?
Yeah, I always find that people are very curious about adjusting infants and babies, and it's one of my favorite things to do for many reasons. Number one is because they respond so darn quickly to care, and it's pretty awesome. I know that you, Becky, have seen several babies adjusted in the office. But think about it, back it up. When a baby's born, is that traumatic or not? Absolutely. Yeah. I mean, think about it. It's one of the most traumatic things that happen to your body, and it happens on day one. So you're shoved through this tight birth canal, and you pop out your shoulders, your neck, and sometimes there's a doctor or a midwife on the other end grabbing your neck, pulling you out, and you're the baby saying, what the heck is going on? No wonder you come out screaming. I would too.
Yeah.
It's a traumatic event. So thinking about the stresses that occur into that spine are the reasons why I check and adjust babies if necessary. You look at birth trauma, which is huge, whether it's through a normal vaginal birth, it's through a C-section, someone has a vacuum extraction, a forceps baby. Any of those things are pretty significant stress onto the spine, especially the neck and upper spine, where they're actually being pulled and stretched almost 2 times its normal length based on medical research. So this is not just like hypothesis or chiropractic thoughts. This is actually medical research that shows that this is happening. So what can we do about it? Well, we can check their spine. And when we check them, it is not like a checking an adult. It's a very different, very gentle process because they've not had the time to develop the stressors on their bodies. And you know what it's like. I mean, you've seen these babies come in. You've seen them, contorted and crying and fussy. And babies should be happy. As long as they're well fed, their diapers changed, there's really not a lot of reasons for them to be fussy unless there's something they're not feeling well. And that's what we call the sign. So we tell parents it's really good to listen to that sign. Your baby's telling you something. You may not use words, but they're using other communication methods. Crying being number one there. So we check their spine. We check for these subluxations, and there can be very subtle misalignments. They might be holding their head to one side all the time. They might have some rotation. It's the pressure I use is like testing the ripeness of a tomato when you're at the grocery store to see if it's something that you want to buy. That's all the pressure I use for checking and adjusting a baby. It's a very light force. Most babies are very happy. They get very relaxed when they get adjusted. Most parents say, hey, can you come home and do that several times today so my baby can fall asleep better? I get that quite often. Come home with us, please. So you could do that at about 9 p.m. when they get fussy again. People come with babies, colicky babies, digestive distress. I've seen skin conditions, upper respiratory conditions. They bring their kids to me for many different reasons, but the whole goal is to make sure that baby is starting out life with a proper functioning nervous system. Because once we have that, the potential for them to grow those new cells, get healthy, heal properly, and be that happy baby is a much higher possibility than if they sit there with stress in the nervous system that is negatively affecting how those nerve impulses are flowing through their spine and their whole body. And it is just exciting. I mean, I absolutely love babies. They smile at you. They laugh at you. I had a little baby who took care of yesterday, a little 3-month-old, and every time he comes in, he gives me the biggest grin and smile. He sits in my lap and he just giggles while he's getting adjusted. It's awesome to see, and extremely rewarding. But not just for the baby and me. Think of the parents and their quality of life. What is it like for someone who hasn't slept for a full night in 6 to 9 months because their baby's up screaming from 3 to 4:30 every night and they don't know what to do? And the message they get from their healthcare providers, don't worry, they'll grow out of it. Well, how long can you put up with that before you wait for growing out of it to happen? And will they grow out of it? And what does grow out of it mean? I don't understand that. Because their baby gets longer and taller and gains weight, that means that their health this all of a sudden improves magically. So many times they need some input. They need some inside-out help. So our job is to make sure that their body is functioning optimally so it can heal itself properly and it can actually get well and heal like it's supposed to. And once they do, the baby sleeps, the parent sleeps, and everything's back to status quo around the house, and happiness is again. So we love kids. It's fun. It's exciting. And it's always great to have both parents here together because I love to see them, see those changes in their baby as it's happening right on the adjusting table.
Yeah. Is there anything we haven't covered that chiropractic can help with?
Well, people come to see me for many reasons. We're not in the business of diagnosing and treating conditions. It's really not what we do. That's what medicine is great at. They're wonderful diagnosticians, and they're great for symptomatic care. I mean, that's what they do. They're awesome. If I get hit by a bus, take me to the hospital, please. I want the expertise that they have and help. People really come to me for what I would consider functional medicine. They have some loss of function. Through either physical means, musculoskeletal, or through physiological, meaning that some system of their body is not working as well as it should, and that's why they seek me out. They want to live a better quality of life. They're literally sick and tired of being sick and tired, and they don't know what to do. And they've seen all the infomercials. They've been online. They've searched Google, and within 3 or 4 clicks, they have cancer and they're dying. And I want them to turn that around and look at the possibility of their amazing body's healing capabilities. Because once you start turning on the power of the nervous system, once you start feeding that body as it should be, you start hydrating it right, you get some movement in there, and I'm not talking it has to be running a marathon, I'm talking walking, because that's the simple thing that they could do. Then I start holding them accountable for the things that they want. So my patients set their own health goals. I don't set them for them. But I'm there as what I like to call the encourager. I like to encourage them along that path to gain that health. I want them to set the goal. I want them to move towards that. People see me for many different conditions. I mean, you name it, and I've seen many of them. I wouldn't say I've seen them all because there's a lot of different things out there. But, from the babies to the mom that just can't lift her head off the pillow, to the dad that wants to be able to go outside and play football with his son, but he can't because his shoulder doesn't work right. And everything in between. So digestive system help, support, immune support. We work with, helping people have a great diet for their cardiovascular system, and people that want to learn how to get health from the inside so they can build a healthy heart, not so they can mask the symptoms of high blood pressure with a drug or medication or 2 or 3 or 4 or whatever they're on. If they don't like being on those things, then great. I'm the person to try and help you out. And I'd love to work with your medical doctor side by side so that we can get what's best for you in your body and we can create the healthiest you possible. Medicine is great at crisis intervention. That's what they do best at, and they're awesome there. And I want to work with those people that are with those doctors so that we can find out functionally what do they need and how can we help them the best to give them a great quality of life and really improve their overall health and well-being.
Okay, Dr. Schulte, if you only had 5 minutes to create better wellness for yourself, what would you do?
I do the same thing that I start with every single day with Becky. I journal and I meditate. And people are like, well, chiropractic, what about getting adjusted? Well, absolutely, I get adjusted. That takes me a minute. So I can journal in 4, and therefore I got my 5 minutes right there.
Do you adjust yourself?
Nope, I go to a chiropractor just like my patients come see me. So every week, at least once a week, I'm getting adjusted.
Cool. What do you journal? What's your journaling process look like for you?
I've got a great little book called the 5-Minute Journal, and it takes 5 minutes every day, and I probably got it down to about 4, but it's actually a great template. My wife bought it for me on Amazon, and it has a great format that I fill in every day, so I'm not, and some people like the free form, and that's awesome. I like the structure of it, and it makes it simple, and it just, I just flip the page the next day, and I start a new page and start a new journal entry, and it's awesome. but it gets my mind in the right way, in the right place to start my day every day.
Good mindset. Yeah, I like that one. All right, and then what is your favorite health habit?
Besides getting adjusted, which is an obvious one for me, my favorite health habit is getting green smoothies in my body periodically. I wouldn't say I do it every day, but I know that I can get a lot of high-density nutrition in very quickly. Yeah, and also you can make smoothies that are green that also have things like apples and or bananas or things like that in them. So for my kids, I can hide a lot of greens in there, and they're like, oh, Dad, these are awesome. I'm like, yep, you didn't know there was 3 cups of spinach in there, did you? So green smoothies are a quick, easy way to really boost your health and get your body alkalized.
Perfect. Thank you so much for sharing more wisdom with me and with all the listeners. If you don't have a chiropractor on your health team yet, give Dr. Schulte a call. And if you're not in the St. Charles area, then find one locally to you that has similar beliefs to what you value and add a chiropractor to your health team.
Becky, I just want to thank you for having me on this show. It was an awesome opportunity. I love to share information with people, and I love to help people any way I can to have a higher quality of life. I mean, that's really what we do in this profession, is help people, and this is another great way to do it. So thanks for the opportunity.
Absolutely. Thank you. Thank you so much for joining us for today's episode of Gather for Wellness Radio. We'd greatly appreciate if you'd leave a review over on iTunes, Stitcher, or the blog. And don't forget to share this episode with your friends, family, and on social media. We hope you'll join us for the next episode. But until then, keep being awesome. The information provided on this podcast and on gatherforwellness.com is not intended to replace a one-on-one relationship with a qualified healthcare professional and is not intended to be taken as medical advice. Becky encourages you to make your own healthcare decisions based upon your research and in partnership with a qualified healthcare professional. The entire contents of this website and podcast are based upon the opinions of Becky Litwicki and her guests, unless otherwise noted. The information provided is for entertainment purposes only.